His personality issues?
Sorry. The iron's innocent on that count. Your kid's a jerk.
Mysterious farmer ailments, super combative patients, and whatever floats your poop. Today, we're breaking down and reacting to all of these shocking medical scenes and head-scratching injuries from one of my faves, House M.D. All right, let's dive right in. Ooh.
As soon as we get a urine sample, we can leave you alone.
You want your sample? Here's your damn sample.
Hey.
Oh.
Oh my God.
Aggressive patients, yes, it does happen for multiple different reasons. Sometimes a behavioral thing, illegal substances, or not taking their medications to keep them calm, versus a bad infection of the brain that can be causing somebody to be altered. A tumor in the brain can do this as well.
Awkward kid who can't get girls because he's creepy.
Why are you doing this?
To stress you out.
You can see that the patient is what we call diaphoretic, so he's sweating, potentially stressed out or febrile. Dr. House here is trying to elicit a stress response, potentially trying to initiate a seizure.
You know that no one likes you, right?
Yeah, well, anybody like you?
You're dying. He's having a seizure. 4 milligrams IV lorazepam.
Right away.
What we call this would be a tonic-clonic seizure. And then he's saying, hey, let's give lorazepam 4 milligrams. Is a benzodiazepine, which is a first-line medication for an acute seizure like this to try to get it to stop.
Got hemochromatosis. Body absorbs iron from food. Can't process it, can't get rid of it. Idle iron is the devil's playground. Builds up in the organs and joints, whacking them in the process.
So Dr. House explains hemochromatosis is buildup of iron in the body. Usually it's related to a genetic mutation. This kid looks yellow, right? The medical term for that is jaundice. They have this like yellowish bronzish color to the skin, and it's most likely due to the liver damage. So the iron is accumulating in the liver and then it's causing damage, which then is leading to elevations in bilirubin.
His personality issues?
Sorry. The iron's innocent on that count. Your kid's a jerk.
It's a very blunt way to go about saying that the personality is not related to the iron buildup. There are other tactful ways to go about saying that's probably not related.
It's like my heart is on fire.
So interesting. People will describe to medical professionals a fire, burning sensation. It's usually related to a nerve, but sometimes when patients will describe like a burning sensation in their chest, it could be reflux.
Can you give me something?
Like a thesaurus? I think you should never mention this during any of your prenatal visits.
Prenatal? I'm not pregnant.
Sorry, you don't get to make that call unless you have a stethoscope.
So he's describing that she might be pregnant, maybe just because of the way her body looks, she's being very blunt, or when people get pregnant, the hormones change and then it does increase the risk of having reflux, especially with this burning sensation that somebody's describing.
Union rules.
I know when I'm pregnant, all right? I have 6 kids. That's why my husband had a vasectomy and we use condoms.
Vasectomies can reverse themselves, condoms break.
So he does make a good point here that vasectomies are not 100%. Vasectomy, basically you're cutting the tubes relating to sperm getting out of your testes, getting mixed into your semen, but it's not 100%. Sometimes sperm can jump or it can reverse itself.
The ultrasound and biopsy confirmed our worry. The tumor is extremely large, at least 30 pounds. But it's completely benign. I've already spoken with Dr. Bergen for the surgery.
If it's not cancer, it can't kill me, right?
No.
Could be related to any organ. Could be a benign fibroid, something of the uterus, or it could just be a benign growth within the abdomen. How could that relate to reflux? You're having something so large inside your abdomen, everything else has to shift around and accommodate for it, which then would increase the likelihood of like poor digestion.
It's about my bowel movements.
What is
Whoa.
these days?
So you open the door and the patient's like, yes, this is my problem. Versus like introducing yourself, saying, hi, what's going on? How can we help you today? Just jumping right in.
Drop your pants, I'll suit up.
They float.
Huh?
My bowel movements.
Fat.
Honey says they're not supposed to.
I'm a nutritionist.
Yes, I could tell from the cool toe loop sandals.
Oh my gosh, funny. So typically if somebody has floating poop, it usually means that you have excess fat within the stools. It could be a digestive problem somewhere else that's causing this versus a high-fat diet or a new diet.
I'm not.
You can have whatever you want. Women are gonna...
He's not cheating with another woman, he's cheating with another food group. These floaters float because they're full of fat. Probably probably had a big cheeseburger for lunch.
You're eating
Oop,
flesh?
there you go.
It's just a hamburger. Not all the time.
You're disgusting.
Soy cakes taste like cardboard.
I'm accomplished.
If the patient had just said, my poop is floating, I was a vegetarian, and I occasionally eat hamburgers, that's most likely your answer, versus not telling the full truth, and then you have to do massive investigations, checking to make sure your gallbladder and liver are functioning the way that they should.
When your retina sees something, they send electrical signals to your brain.
Those are probably contacts that are basically picking up signals, and that's so they have to be connected to power.
These lenses will pick up those signals.
Ah, there you
The
go.
signals are misfiring. It'll confirm that an old man without a medical license is smarter than all of us, that your hallucinations were caused by the...
They're not hallucinations. Don't make it hurt.
So they're trying to see if this individual has visual hallucinations. So visual hallucinations versus auditory hallucinations. A lot of times when you have something that's a visual hallucination, you're concerned about something going on in the brain versus the eyes. So they're trying to investigate, which is really good that they're investigating further to see where this is coming from.
Coding eyelash.
Lean forward, Irene. You're gonna aspirate. I can't. It hurts.
Hematemesis is bloody vomit, and it's quite dangerous because you can be bleeding in your esophagus, in your stomach, maybe the first part of your small intestines, aka your duodenum. And if you have persistent bloody vomit like that, it increases the risk of hypovolemic shock and death.
Jimson weed, belladonna, mandrake root, and moldy bread.
Moldy bread.
It's ergot poisoning.
You'd need damp grain.
Completely unprocessed and untreated, like what's in that organic rye bread she's been eating.
You start putting everything together. You have 6 doctors in the room here, and they're trying to figure this out. They're internal medicine docs, a lot of different specialties, subspecialties, so they have a lot of resources to pull from.
It's the stuff they make LSD from. The treatment you're on should...
So I've just been tripping?
It explains the hallucinations, seizures, delusions, constricts the blood vessels, which explains the necrosis.
Wow. We don't really even see LSD anymore either. So LSD used to be a big drug back in the day, but we don't see it very often. But it is definitely a psychedelic and could cause all the symptoms that they described.
I thought we were starting with the farmer's case first.
We are.
This is a
If
farmer.
we're gonna look at a leg, I need you to take off your pants.
So first off, if somebody is going to expose a body part of the opposite sex, you need to typically have a chaperone in the room to just make sure nothing nefarious goes on.
Puncture.
Snake bite.
That would be my guess.
Farmer didn't know he'd been bitten by a snake.
That's what he said. Sudden shooting pain, tall grass, never saw a thing.
So a lot of times when people will describe a snake bite that they come to the emergency department, they usually don't feel the pain. They feel the after effects there or see the snake and they're like, oh crap. And a lot of times we'll get people that come to the emergency department with these like kind of like boil type lesions and we'll say they were bitten by a spider. And then our next question is always, did you see the spider? And the 99.99999% of the time, somebody will say, no, I never saw the spider. So then we always ask, well then how do you know it's a spider bite?
What kind of snake?
You want me to tell you what kind of snake it was from the shape of the hole in the leg?
Well, how are we supposed to know what kind of antivenom to use if we don't know what kind of snake it is?
Great question, but there's only one type of antivenom that we have to use in the United States, and it covers basically pit vipers, that type of category of snakes here in the United States. Typically we worry about rattlesnakes and copperheads. This is so much fun trying to figure out the medical issue and using my skills and the knowledge that I have off the top of my head to kind of figure out what is happening. So if you guys enjoyed this and want me to do more Dr. House, please let me know in the comments. I would love to do more. And as always, do me a favor, binge watch this playlist right here and subscribe, turn on your bell notifications and hit that like button for me. Thank you so much for watching and stay healthy, my friends.